My name is Alexa, and together with Camilla and Carla, we are representing the KI ISPOR chapter. First, we hope that you connected successfully, and please let us know at any point if there's any issues with sound or anything like that. So with us today, we have Dr. Karen Freijer, and she will be talking to us about nutrition economics and why it is essential for global health. She's the founder of the ISPOR Special Interest Group Nutrition Economics, as well as the general manager at Partnership Overweight Netherlands. And she's currently housed at the Erasmus University Medical Center in Rotterdam. So we will first be walking us through what health economics is in the context of nutrition and what it actually entails, as well as real life challenges and the current applicability of it. The talk will last approximately 20-25 minutes, and we will have time at the end to address any questions. So please send those at any point in the chat. And yeah, without further ado, Karen, you have the stage.
Thank you so much, Alexa, for introducing me, and thank you all for joining this session. Well, I was introduced, so I won't say anything anymore. This is always a disclosure, not a lot. The outline, as Alexa has told you, is about, first of all, about nutrition, because it's a very specific science, and then the challenges for performing health economics for nutrition. I think everyone should know this one from Hippocrates. Let food be thy medicine and medicine be thy food. It was in the earlier years before when we started about with nutrition economics, that was in already 2008. We saw that a lot of interest was already there for nutrition, but not that many. So I have Googled what the situation is now. And as you can see, a lot of interest now in nutrition. It's about 1 million hits. But that's also the dangerous part, because nowadays everyone is thinking they are an expert on nutrition. And as you will know, you will see a lot of people stating their cooking books or whatever. And that is what I want to tell you. Already in 2003, at the left side, you see there was a report of the WHO about diet, nutrition, and the prevention of chronic diseases. So it started at that time already. Now, the key facts in June 2018, you see that it's going further and that we have more insights. The non-communicable diseases, as you will know, as diabetes, blood pressure, a lot of the Western diseases, as we know, are based on lack of good food. So we are very glad there's more attention for it. But now we have to really go into the right pathway to have the right results. Also, the OECD, I think you will know them, if you will know this institution, is about performing economics for several diseases, published a lot about obesity, because it's a very important disease of the modern time, as you will all know. And this is the latest report, the heavy burden of obesity, including the costs of obesity. So for you all, it will be very interesting to read this report, as where nutrition is also a big part of. Another thing is, luckily, there are a lot of cost of illness studies already been done to see the costs associated with those non-communicable diseases, as you are seeing over here. So that's a good start. But always, when you have cost of illness analysis, you have to show also the cost effectiveness of interventions which you are doing and which you are performing. And this is really an important point we are now going to discuss. First, I want to show you also that next to obesity, also undernutrition is a very important problem, which is a little bit under the ceiling because you are not seeing it. Obesity and overweight, everyone can see someone having that or suffering from that condition. But undernutrition, not only in the poor or non-Western countries is an issue. It's also very available in around the world. Even in persons who are suffering from overweight or obesity, they can still be undernourished. So this is also a WHO expert stating that malnutrition is a really big issue. And please keep this in mind, because I'm coming back to that later on. Also for malnutrition, we have conducted cost of illness analysis. As you can see over here, these are a review of the European countries we performed the cost of illness analysis for. Whenever you want to know more about how we did it, I can inform you, and I can send you the references for it. Then, okay, what is nutrition about? Because that's the most important thing. I saw this one. It's the science of nutrients, and this is exactly what it makes this science so complicated. I compare it always with a car. Everyone knows that a car can only go ahead, drive, when you fill it with gas and oil. For the human body, it's exactly the same. The food, the nutrition we have to eat and drink daily is our gasoline and oil. It's not only the amount, but it's also the quality, which is very important. You can also see that when you're not giving the right gasoline or the right oil to the car, into the car, it will stop. And that's exactly the same what's happening with your body. When you are not getting enough of the right amount of the right nutrients, your body is slowly going to stop. So you're getting ill, and after your illness, it's getting worse, and you go into the hospital, and it can even lead to death. So every nutrient, which you can see here, especially the protein, is very important. As you can see, it is important for almost everything in our body. And that's the main thing which makes it so difficult to perform research for, because the nutrients are polyvalent and act in concert and depend on one another. So what to do, how to perform the research, as where there is a person who is having their own daily diet, and you want to investigate what a supplement or some ingredients on top of your daily intake is doing. It is very, very difficult. So which I showed already, when you get not enough of the right nutrients, you can die. And this is a very important one to bear in mind. When you're healthy, so when you have enough of the nutrients, we know that you can stay alive for 70 days when you are not eating well. And that we know from researches when people were in hunger strike. We also know from research that when you are suffering from a condition, also diabetes 2 or the non-communicable diseases, or when you are having cancer or whatever, we know that when you are not getting the right amounts of the nutrients, you will die already after 28 days. So that is really showing how important nutrition is. And we're very glad that there is more attention for it. What we did together with the people we performed, or we made the nutrition economics, we made a division. You have an overall population for which the general nutrition is important. So for all of us, we have conventional food, we have functional food, and we have infant formula or normal food. So that's about the public health and the prevention side. But you have also the population who are already suffering from a disease, so the patients. And for that, there are specific nutrients necessary. So we have in the medical nutrition, we have enteral nutrition, so via the your bowel system, or you are having parenteral nutrition available, and that's going via your bloodstream right away. And that is so for people in the healthcare. Together, you can talk about the integrated care, but it's very important when you are performing research in for nutrition that you do this specific research. So don't think that the nutrients that we are needing every day is sufficient for people who are suffering from a disease. It's a total different area. And this is exactly what we want to show in nutrition economics. It's very complex. So the complexity of nutrition, it interacts with multiple interdependent processes. So you see at the right side on the screen, on the picture, that pharma normally is focusing on a single target and having a large effect. Whereas food, nutrition, is having small effects perhaps, but on multiple targets. So how are you going then to perform the right research? And we all know for performing health economics, you have to have good data. Otherwise, you cannot do anything. So different targets, and you have to be aware then, okay, what are the RCTs, or what is the research behind the data you are using to perform the health economic analysis for? Because when the data is not good, then you are performing health economic analysis on data which are not right, and then you have the wrong results. So the thing we are always stating, pharma, normally it's a chemical entity. You can see what it is doing on a single intervention, and you can follow it through. But for nutrition, it's the combinations, and it is very hard to know what the right results are. So that's what we wanted to do with nutrition economics. We want to merge the nutrition science with the health economics discipline. Especially the interdependency between the nutritional habits and the health and the public expenses. Because we need the insights for spending our money on different interventions. We also sat together with a group of experts to make a definition of nutrition economics. And it was a hell of a job, but okay, it's always with a lot of experts. What is the definition? This is now an internationally definition which is used in a lot of researches, that it is a discipline dedicated to researching and characterizing health and economic outcomes in nutrition for the benefit of society as a whole. As we seen it through the lens of cost economics, of health economics, we were stating that nutrition economics, as it is so difficult, as it is so different from all the others, from all the other health economic analysis, that we suggest to make it a new area within the health economics field. So this is the whole pictures, and hopefully we can follow this through, that in the future people can see that it is a little bit different from all the other health economic analysis that has been performed. We also hope that bringing together those two sciences, so nutrition science, sorry, and the economic science, that's from both sides, that economics persons get to know more about the nutrition science and vice versa. So it's really working together and introducing each other in the difficult and differences in the sciences, the expert fields. We also sit together with a few experts, international European experts, to see what the challenges would be when you are performing a health economic analysis for nutritional interventions. The first thing is there's a difficulty in establishing a correlation between the product's consumption and the future health status. And hopefully you can understand why, as the nutrition is having a lot of nutrients and working on different areas in the body. Then the time frame of the study must be long enough to capture the relevant events for assessing effectiveness. It is not a study that you can see right away, which you can sometimes do with the drugs, that you can follow it for 3 months or 6 months or 1 year, and then you see the results. Because as more bias you are having, the more people you have to include, and also the more time you need to follow through. And as the long time span is needed and the number of relevant events increase, the complexity, uncertainty is there. So you have to keep that in mind and to see how you can or how you will evaluate the studies which you are using to perform the economic analysis. And as I stated also before, always when you want to do an intervention with nutrition, it is always on top of the individual nutritional profile and the daily dietary intake of that individual, of that person. And the next or the last thing is that normally the foods are not subjected to reimbursement, and that's especially for the public health area. So why are you then performing the cost effectiveness of nutrition? This is the publication which I talked about that we set together with a few European experts, stating all the challenges we saw. So when you want to go through it, you can find it over here in this publication. And we have even more, but this is really the basic level. Although there are a lot of challenges, we can perform economic evaluations. You can do that only when you are having or bringing together the science persons from the nutrition world and bring them together with the health economics persons to know what to do and how to evaluate all the data that is available, or how you want to evaluate studies or performing the studies in the right way. We did a lot of, as you can see, it's going fast, but we did a lot of systematic reviews to see what the quality is in the economic evaluations out there. And nearly all of those economic evaluations, the systematic reviews, is about the performing of the nutrition research, that it is not sufficient to perform a right economic evaluation. And it's all about the methodology. It's the methodology of performing those nutrition researches. And within the nutrition world, we're even not aware about what is then the systematic, the international system that we can perform the highest quality of nutrition research. Even within the nutritional world, we're not aware. So it's so important that you really take people into your team to discuss those issues. Other challenges we know is this is one of the scatter plot of cost effectiveness for nutritional intervention in elderly who were more malnourished, and they got medical nutrition because the malnourished people are in need of more nutrients. And as you can see over here, the average ISER is on the good side. It's cost effective and nearly in the dominant area at the right side underneath. So you would say it's a very cost effective intervention. What is the QALY? What can we say about the QALY, the cost per QALY? Well, that's an interesting question because we were not able to show that this very cost-effective intervention was also a good intervention regarding the QALY, the cost per QALY. And we think about the EQ5D, it's a very general instrument, and it is not specific for nutritional interventions. When you see the questionnaire, it is not doing anything for nutritional interventions. So together with health economics persons, we are now into research to perhaps adapt the EQ5D, especially for the nutritional interventions. So that will be a great opportunity to have more instruments to show the cost per QALY is also a good intervention. This is something I wanted to show you. There have been a themed section of the value in health. It's a magazine of the ISPOR, and it is all about nutrition economics. But when I saw some publications, I saw only the health economics persons as the author. And most of them, not even, perhaps all of them, are not aware of those challenges I just presented to you. So you can imagine that when they are using the data in the way not involving all those questions you have to be aware of, that the results of the evaluations they did are not the right ones. So it's very specific, and we have to be very careful for interpretation of the results presented perhaps also in this magazine. Well, we have now two special interest groups performing and discussing about nutrition economics. That's also making plans. What should we do? What has to be done still to improve the quality of nutrition economic analysis? And we're not there yet. It will take a lot of time, but the more the people know about the history and all the challenges, the more we can have the best results of the nutrition economic analysis. We, as the SIG, the special interest group within ISPOR, we thought it is best to start with definition and to start with explaining the nutritional world to the health economics world. So this is the publication we had it's an article we had published in 2019 to start within the ISPOR Society to show them what nutrition is about, especially what I talked about, and also what all the different definitions are meaning. And we are doing the same in the nutritional world about health economics. So we are having health economists talking about what health economics is within the nutrition world. That is already my closure, because I think it is not good to only listen to this whole story. I think we should interact together and listen to your questions you are having. The best thing to do for us, we think, as nutrition economics founders, that we have to bring the two worlds together. So we have to bridge the nutrition world together with the health economics world. And then we have the new area of the nutrition economics. That's in a very quick way showing you, hopefully, what nutrition economics is about and what the idea is behind it, and that nutrition is very difficult and it cannot be compared with the pharma, more with the medical devices, but not even, and that we really have to sit together to make the best out of it. Thank you so much for your attention, and hopefully you have questions.
Thanks so much, Karen. That was really, really interesting. And I hope that not only will people watching this today find it interesting, but I hope that some people will be catching up on the recording later. So I hope that we can maybe get some nutrition students to watch this to bridge that gap.
Yeah.
We've already do have a few questions. If there's more, then put them in the chat. Okay, so we have one. Tango, thank you for your question. It says, what is meant with advancing the EQ5D? Is it adding more items to the EQ5D? And what are the possibilities to not increase the burden on responders?
Yeah, exactly. That's a good question, because that's always the issue. You mustn't increase the burden, although you must have the right questionnaires. And this is exactly what we are now in discussion with health economics experts in the Netherlands, together with nutritionists, to see whether or not it's necessary to adapt the questions or even have some more questions. But we think about the first, to adapt the questions. But we don't know yet. So we are inviting everyone to think about it together with us, to come with the best questionnaire, and we have then to see whether or not it's a good one. So yeah, it's already, it's again, research, and we're not there yet. There are a lot of years to come.
So that sounds like a big project for your research group. What other things do you have ongoing at the moment, or is that like really the main focus for you?
Yeah, exactly. So yeah, hopefully we will get there, and within 2 years, hopefully we will be further than where we're now. But it will, I can say we started already, as I said, in 2007. So you see how much time it takes to come up with something. But it's good, because otherwise we're out of business.
Yeah, of course. How did you get into nutrition as a specific area? And what's kind of the background of people who tend to be working in it?
Yeah, also a good question. I am myself a nutritionist by education. So that's where it's coming from, the nutrients and the nutrition. That's a very important area. And during my work within a medical industry, medical nutrition industry, I came across the question from the government about, okay, show me then, when you are stating that's so important, show me then that it's also important in the meaning of cost effectiveness. And I didn't know what they were talking about, but I saw also in the Netherlands that when we wanted to have the products which I worked for reimbursed, that it is very necessary to show a budget impact, a cost effectiveness analysis, and so on. So that's why I got interested in it. And then I was asked by the University of Maastricht whether or not I could be a PhD candidate, because it was very interesting. And there was not a lot which had been done already on this topic. So that's why I started this. And I came across a lot of other people, and together it's growing. So that's how it's all started, only from my own experience in the field and the questions and data which was necessary to get reimbursed for nutrition.
So do you feel like it's the kind of health systems and institutions which are going to be behind a push towards doing more nutrition economics in the future, or is it also a kind of supply side from your end?
I think it will be more and more necessary in the future. As you saw already, that a lot of attention is now there for nutrition, and that's good. But still, we don't have a lot of money which we can spend. So you have to make choices. And when we are not showing the nutrition economics, the nutrition cost effectiveness, I think really that is out of business. When you're talking about reimbursement, then it's only about drugs or medical devices. But we want to change that, because drugs and medical devices are very expensive. And with nutrition, you can be very cost effective and investing less money with more effects. But we have to show it. And when we're not doing that, it will stay the same. And then we will stay in the area of medicalization.
And where do you kind of, because I guess what you're saying is that there's a problem in terms of where the funding for this sort of research comes from. Where do you think that will come from, and where does it come from at the moment?
You mean the funding for the research, the nutrition economics research? Yeah, exactly. Well, that's also a big issue we have written down in the publication, that when you want to perform a good, high quality nutrition research, a nutrition trial, you have to have a lot of patients to include, because there are a lot of bias and cofactors. So that's one. The second one is also the time frame which I showed you. Within 3 months or 6 months, you cannot say anything about what nutrition did, the intervention you performed. So it will take a long time, and you have to have a lot of patience. So you can imagine how much money it will cost to have something. And then you see that a lot of people are not able to give that money to perform those high quality research. And it should change, but that's the difficult part. And therefore we need, again, it's like the chicken and the egg. We need the nutrition economics data to show that it's a very good intervention, and that you have to have the information and so on. Makes that sense a little bit?
Yeah, I suppose we don't know yet. I mean, it's kind of a new area, and we don't know how the system will adapt to this sort of research. And as you say, medicalization, obviously there's a push towards it in terms of the structure of funding. So I guess that's a challenge for the future.
Yeah, it's a real challenge.
Yeah. We had a question about, you showed a difference between, for example, England and Germany and the economic consequences of malnutrition, and then a question on if you could comment on where that's coming from, whether it's because of the study design, or is actually a problem in those countries, for example?
Yeah, it was first of all it's the study design, so also the data they used to perform the cost of illness analysis. Because in some there were only hospital costs involved, and in others there were also the society costs involved. But also the methodology was so different that you saw that the outcomes are so different. So that's also the challenge. How can we perform a good, high quality cost of illness analysis in the same way? So you need also in the countries the same data. And now, because it's so, yeah, it's not of everyone, it's not so, it's not written down yet, systematic, that everyone is doing it in their own way. And then you can get all those different outcomes, and it's not good at all. Is that
Yeah.
the answer?
Yeah, of course. I mean, it was quite a substantial difference in terms of the size.
Yeah.
So I wonder if you think there is an underlying difference.
It's especially how the people were performing the cost of illness analysis. It's really about the methodology and the data they used.
Yeah, okay. It's good to know. I'm English, so I'm glad that it's not that terrible, but wouldn't surprise me too much if it was. We had a question about qualies, which you said were not a great measure for the effects of nutrition. And you said that you were looking to develop some new instruments. I wonder if you could kind of expand on whether you're going to alter that for different age groups, for example, because you said there was a big difference there, and anything else you can mention about that.
Yeah. There are a lot of co-founding issues in that matter. I have now also contact with the HDAI. As I said, they also have a special interest groups over there. We have a nutrition economics interest group, but we also have, not we, but there's also a group which is focusing on obesity. So together with that group, we are really looking forward to start a research group to see what we can do and what is necessary to be able to measure the quality of life in the right way so that we can say anything about qualities. But it's too soon now yet to say anything about it. We only know that we performed some studies, the nutritional with medical nutrition interventions, and that's even easier than in the public health with general nutrition interventions. And we saw over there that within 3 months and even 6 months, the cost per quality was, we could not say anything because the quality of life, there wasn't anything significant in the outcome. And that's very strange, as we saw that the intervention itself was having a lot of good results. And we saw already also in the measurements of, for example, tying the adults was elderly, malnourished elderly, and we saw that they were able to walk on themselves without having anyone supporting them or climbing the stairs themselves. And before the medical intervention, it was not the case. So why were we not able then to find anything significant on the quality of life?
I guess that really ties into what you were saying about trying to get more nutrition experts involved in creating that.
Exactly. Because in the nutrition world, we have very good measurements on how to measure that effect. But you have to know which measurements are there, what is the scientific behind it, the scientific science behind it, and we are also improving time and time again.
Yeah, that makes sense. We have a question about the application of the research. So if you have examples of how nutrition economics has impacted interventions in the health sector, or how it's impacted on policy, for example.
Yeah, we have, well, thanks to the interventions, or thanks to the analysis we could do for medical nutrition in the Netherlands, and also in which other country, Ireland, I thought, we changed the reimbursement situation for the specific medical nutrition products. So people were not getting the right nutrients. For instance, people suffering from cancer, they needed a lot of more nutrients. And thanks to the nutritional or nutrition economic analysis, we are now having the reimbursement for those products. So that's also, again and again, the healthcare setting. For the public health, it's a different setting and a different mindset because it's on the prevention. But that's even further from where we're now starting in showing first what you can do when the disease is already there. And from there, I think because we have good experiences within the Netherlands government, and also I thought what I said in Ireland, that we have reimbursement based on those studies. And now we have to take it a level further to the prevention section, and that will be a very big challenge.
Yeah, I think that's obvious, and I think that there are really clear links to public health, right? I mean, I think that seems like a more relevant area in terms of how food is in your daily life. And you said there's going to be a big challenge there. I mean, if you want to tell us what the big challenges are relating to that.
Yeah, it is especially nowadays what I said and showed you also, the big issues nowadays in our healthcare is the obesity and the malnutrition, the both sides, because from obesity you can have diabetes too, you can have cardiovascular diseases, you can have a lot of things next to obesity. And also when you're malnourished, also a lot of diseases are due to malnourishment. So those two issues, you can solve with nutrition as part of, together with movement or other sections. But how are you going to show them that it's cost effective?
Yeah, of course.
Area.
And given that malnutrition and obesity are, I mean, they're not just problems in countries like the Netherlands and Ireland, but they're also a huge factor for global health consideration. Are there any kind of multinational institutions, like for example the WHO or the UN Food Programme? You think that they have enough of an appreciation for nutrition economics?
It is starting. It is coming. A few years ago, we had, together with ISPOR, because WHO is also connected with ISPOR, so we now see that the interest is growing, it's increasing. So hopefully, together with other people and sitting down, but we have to sit down and we have to take care of the really good overview of how to perform the best nutrition research. And then next to that, the best nutrition economic analysis. But we need a lot of people, and especially the WHO, all the reports they are now making, it's all about malnutrition, it's all about obesity and all the costs coming together with it. So they are forced, I think, now to think about it.
Yeah, and I suppose as health economists, it's easy to say, like, we need to do economic evaluation of everything, but it's a big step to actually being able to do it, right?
Yeah, exactly. And I can imagine that because for pharmacoeconomics, it's already during years and years and years. So it's very known. We have guidelines, international guidelines, how to perform the pharmacoeconomic analysis. So perhaps when you're not knowing about all the difficulties in the nutrition area, you think, okay, well, it's the same. So why not performing the pharmacoeconomic of using the pharmacoeconomic guidelines also for the nutrition data, nutrition research. And that's what now is happening. And the outcomes are, okay, it's not cost effective. Okay, we cannot perform, so we are not able to use the outcome then to show WHO that it is very good to invest money in the nutrition because it can be very cost saving even. And that's the issue we're now facing. And that's why I always say be careful what to do of how you perform the economic analysis, because the outcomes are then can be negative and then we're lost.
Yeah, and I suppose another important thing is the distinction between cost effectiveness and budget impact in this area. I suppose that the budget impact is kind of huge for a large scale malnutrition program, even quite cost effective.
Exactly. And how to cope with that, people? How do we do that? Because in the mindset, everyone knows that, yeah, when you are healthy, then it's costing less. And when you are having a condition or a disease, it's costing more. We know that. But okay, now show it.
Have you considered anything about evaluating joint interventions? So someone sent a question saying, for example, evaluation of nutrition and exercise combined for something like obesity.
Yeah, we do that already, because nutrition is not on itself, and that makes it so difficult. It's never alone, never ever. So for nutrition, it's always important to do something about the exercise, but still, when you are performing then the trials, how do you make a homogeneous group? You perhaps never ever be able to make a homogeneous group, because everyone is having their own lives. And when you compare drug intervention with a placebo, then what I said also before, you don't have the interaction of the nutrients with all the other things that are happening in the body. So that makes it so difficult. So it's always about more than only nutrition.
And that leads to the challenge of establishing effectiveness, of course.
Yes.
Well, we don't have any more questions, I don't think. So if anyone has anything, please just put it in the chat quickly. Anything will do, as long as it's relevant and that Karen can answer it for us. Otherwise, we can close slightly early and let everyone end their day. It's been a really interesting conversation for me, and I hope that we can share this recording with some people from different backgrounds and hopefully get them interested in your special interest group. I suppose this is the link to share for the one that's on screen now for what you are up to at the moment. And also you can check out the ISPOR website, which will also have updates from the special interest group. And we will share the Value in Health Nutrition edition that's just come out on our social media, so that if anyone wants to go and critique the approaches, then you can go and do that. We have a few events coming up. We should be able to put a slide up right now. One of my glamorous assistants will be able to share it with us. As with all of our events, you can check them out on Facebook and register for the Zooms. I'm just waiting to see the information. We're having some issues with permission, I think. But yeah, I would like to thank Karen very much. That's a really great talk from you, and appreciate you taking the time out to talk to us about this.
And whenever there are many questions or more questions, let me know, no problem. And hopefully yeah, we can join our efforts to make it sustainable and to show that investing on nutrition is a good thing.
Yeah, thank you. Okay, we have our events. Sorry, I don't have them all memorized. Our next one is next week. National guidelines, how they're put together in Sweden. So that's interesting for anyone who's looking to work more in the healthcare in Sweden. An event on digital health. Again, that can be very interesting for people who are looking to work in that area, as well as machine learning coming up in April. And then we just have 2 more events in May, one from our PhD series, and then a medical devices assessment talk as well in May. So sign up for those on Facebook. Let us know if there's anything else that you would like us to see, because we are always trying to put events that people are interested in and not just run things for our own sake, even though they are quite fun for us. And yeah, just thank you so much, Karen, for talking with us.
So welcome.
And good luck with your research.
Yeah, thank you so much, and good luck all with all your research and all your jobs and work. Still a lot to do.
Okay, thank you.
Bye-bye.
Have a good afternoon, everyone.